this kind of score, it's easy to achieve as with a little bit of practice. People think that IELTS might be a difficult exam. It's not. So
But
after
how did you prepare for the exam? Did you take any coaching? I'm sure you must have prepared for the English exam in India.
so the English exam that I took up in India was for the PR application process, and that was the general IELTS. The English exam that I took up here was the academic IELTS. So I actually prepared by just going online, looking at YouTube videos, doing those tests again and again and again, going past back a few years and doing tests. So you're a dental student, you tend to take tests again and again in your life. You've taken innumerable dental tests to reach there. So these exams aren't a big deal. A little bit of practice and anyone can score above 8.5 in the IELTS. That's my opinion.
So you have two types of IELTS exam.
Yes. One is the academic, which you use to apply to schools and educational institutions. The other
Yeah.
is the general, which is for PR and immigration process.
But what is the difference? Because I never heard about this important point.
So the basic difference between the IELTS academic and the IELTS general is the writing part. So if I remember it correctly, in the IELTS academic, we had just a letter to write and one small essay of sorts to write. In the academic part, you have an evaluation of a graph. So you get a graph or a diagram, and you have to basically evaluate what you see in there, write down your notes on that in a specific concise way, and which can be construed as academic. So you have to you might be given a graph, you might be given a pie chart, you might be given a situation that you have to break down. So it's kind of
This is like statistics. What we write in the literature, is it like result evaluation of an scientific article?
not as
So
difficult as that, not as complex as that. This is actually pretty simple. So I don't know, I'm not explaining this very well, but there are some videos online that really help. One of the videos that I found very helpful, for one of the channels rather, I found very helpful for IELTS academic, was a person called IELTS, IELTS LIZ or LIZ. So IELTS Liz. She was amazing. She basically has these videos explaining what to write for each point of the bar graph or the pie chart, how to break down that chart. So it is kind of statistical, but not at all at the level of our scientific articles.
you said the first exam, AFK one exam, the first exam is very important. If
Absolutely.
you did your post graduation, but do you think a undergraduate student from India with a plain BDS degree will he have any chance of getting selected? I'm sure, as you said, it may be very subjective and you may not have a complete idea, but do you think there is any chance? Do you know anyone who got into DDS program just with a BDS degree?
Absolutely. So I'll give you the statistics of my class. My class that is graduating in 2021 now, we are 24 students. Out of the 24 students, six of us have advanced degrees, as in masters in the various fields. So I have a master's in endodontics. My wife has a master's in orthodontics, and she's my classmate as well. She's my batchmate with me. My colleague, he has a master's in medicine and radiology. I have two more friends who have masters in periodontics and oral pathology. Okay. Now, apart from the six out of 24, the 18, they're all BDS graduates. They're all of them BDS grads, and some of them are younger than me, much younger than me. So one of my classmates is about 26. So she graduated and directly applied. Another classmate is 24. So she just graduated, finished her graduation, and came down here directly and applied. Uh, One of my classmates, he is 54, and he wants to go to school. He wanted to go to school. So you have a wide range of ages, you have a wide range of educational backgrounds and experience. But yeah, anyone can actually join. If you're a good candidate here, you get selected. That's it. It doesn't matter what your educational experience is or if you have additional experiences.
But how do you decide who is good? See, like I can understand someone who has a post graduation, maybe They have a resume with a thesis, some publications, some presentations. Do you know? Because see, this channel mostly helps the undergraduate students because I've been guiding them from so many years, and there are many undergraduate students who ask me that what are the options in front of them. What do you think as an undergraduate? What additional thing they should concentrate during those days? Like I'm sure you must have spoken to those students, those colleagues of yours who have joined with you. What do you think was the very important aspect of their resume which helped them to get into this DDS program in spite of being a BDS candidate?
Now, I would just wanted to tell that I do not agree that in spite of being a BDS candidate, you would get selected because let me tell you, when you apply to a dental school, that application process is a leveler. People with BDS, people with MDS, everyone is at a level playing field.
Oh,
So from this point of on, you are judged solely by how you perform in the exams that the schools have set, because each school has its own way of selecting students. Now, for instance, the University of Toronto, they just conduct one interview. It's called the multiple mini interview style of interviews. So they conduct that interview, and in that interview, they will look at how the candidate performs, how the candidate answers certain questions, what is the personality of the candidate, and that performance right there is more important than whatever profile the candidate has at that point. Because I know for a fact there were people who had advanced degrees, who had a PhD, and who had masters and few years of experience. They were not selected in the application process a year ago, but graduates with BDS degrees or just new grads, fresh grads who had just gotten out of dental school with not much experience, who had just had a BDS degree, they were selected. So just having a BDS degree is not at all a weakness. It's about how good your personality is, how well you perform that day in that interview. And in some schools, there is an additional bench test where you have to do a class 1, class 2 cavity preparation, a crown prep. So your hand skills are also evaluated by some universities, like the University of Western Ontario or the Dalhousie University. Most of the other dental schools, apart from University of Toronto, have that additional bench test part. So they kind of evaluate you as a whole and not just your profile, if you understand what I mean.
yeah.
It's kind of in a very holistic way that they select candidates there.
Yeah, and it makes sense because everybody has to appear for that IELTS exam, and you have to appear for the AFK. And someone who has better score in those exams, I think they would definitely have better weightage because those
Uh,
exams are the Canadian exams.
Absolutely, absolutely, yes.
I really appreciate the information what you are sharing, and I have never heard so much of information from anyone. But I also want to compliment you that you keep on mentioning about your personality. I really exactly don't know, but I remember the day when I had met you during, maybe you were just very young, and the way you speak now, the command on your language, your personality is simply amazing. And I'm sure that's why, maybe it's over a period of time you have developed it, but you speak really amazing.
Thank you. That's just life skills. That's what life does to you.
Now, since you said that you have to appear for the bench test, I will come to the AFK exams later because as you and I have decided that we will be speaking more in depth in maybe another podcast. You said you have to appear for bench test. How do you prepare for this bench test? Because I can understand AFK, maybe you have books you can read, but many of the students, whenever I have conducted podcast with the students for foreign exam, they do tell me that they have taken some coaching from some center. What do you think is helpful for bench test of Canadian dental schools?
So that's a beautiful question. Again, now I'm not trying to promote DSTC or the organization that I work for, but we actually conduct preparatory courses for the entire spectrum of the Canadian exam. So we conduct the preparatory courses. Well, not me per se, but there are other instructors who do that. Much more experienced instructors who do the Canadian bench test. prep course. So basically, you have an entire simulation center here in Toronto. There are 4 centers in Canada. So we have a center in Toronto, we have a center in Mississauga, Malton, and Brampton. So these are all areas in and around here. Then we have centers in BC or British Columbia. We have centers in Edmonton, that is again in Calgary. Sorry, Edmonton in Alberta. So we have basically centers all over the country, and these centers have simulation clinics. So we have the same mannequins or the phantom heads that we used to practice these preparations on, and we have instructors who teach you how the Canadian schools, they evaluate your preps, like a class 2 prep or a crown prep. What are the dimensions that they want? Say if they say a metal crown, what is the dimension of the margin, what is the dimension of the occlusal reduction, how much reduction should we have on the buccal, lingual cusps, what are the planes of reduction. We kind of they give you a very holistic, in-depth tuition or tutorial on what to do for each situation. So we train over a period of almost 6 months. So when I was applying to the dental schools, I took up this training course with DSTC. There was a very experienced doctor by the name of Dr. Chang. He incidentally was also a dentist from India. He was a dentist from Bombay, and he basically was a graduate from the University of Toronto way back in 2008, and he took this course. He taught this course on how to do class 1 simple. So simple class 1, class 2 preps, crown preps, inlays, onlays. These are things that we have done at some point in our life, but we get an additional idea of what exactly we need to do to make sure our preps are acceptable by the Canadian standard. So there are certain slight differences in the way that we were doing things compared to now. So for instance, when we work on our preps, we look at ergonomics as an afterthought. So when you're working, especially me, when I was working in my BDS days, when I was working on the phantom head, I'd be all inside the phantom head space.
Yeah.
So out here, you actually take ergonomics very seriously. You take your posture, you take your working distance very seriously. We use magnifications, we use loops for everything. I have one pair of loops for about 2.5x. I'm buying another pair for about 6x just to help with additional clinical work. So that part, ergonomics, that is overlooked by us in our training. But out here, when you apply for the Canadian bench tests, they actually look at your posture, whether you're working in a proper position, whether you're working in the 9 o'clock to 12 o'clock region, or are you going into the 1 o'clock or 2 o'clock region, which is technically the dental assistance area. So these things we don't keep in mind because we're not really concerned about four-handed dentistry, but that is the norm out here. So we kind of are unaware of that, and that mistake might cost you the bench test. So we need to know all of this. So that's why training actually helps, and training in simulation center is what is provided at the training institutes out here. And by no way is DSTC the only training center. There are many other training centers here in Canada. All of them, they are all at the same level. They provide you with the same kind of training and expertise, but it's a personal choice what you select.
And how much does these bench test courses generally cost?
So on last count, the bench test course cost anywhere between $8,000 to $10,000. It is not cheap. It is expensive because it is carried out over about 6 months to train you. You have chair time, you have instructors there, so it is a bit expensive. But in the end, the entire process of getting into dental school is a bit expensive. The entire process of applying for direct licensing is also expensive, albeit slightly less compared to the dental school route. But we can discuss that in another podcast.
I always ask the people who have shifted to foreign countries, who are studying in foreign universities. I ask them, what do you think that maybe our dental schools in India could have done better, or maybe they should concentrate more? Because since you have already almost finished your dental school in Canada now, what do you think that things can change in the dental schools of India, which can help the students maybe to go abroad, or maybe to perform better in these foreign exams?
So I have one big change that I would like to see in dental schooling in India. This is something my guide at my master's program, she always used to stress on. Dr. Rupa Nadik, I believe you know Dr. Rupa Nadik. So Dr. Rupa Nadik always used to say that we should start treating patients as a whole, not just, having tunnel vision and looking only at endo or looking only at perio or looking only at prosto, right from the undergrad level. So there is this concept here in the University of Toronto. It's called the CCP, or the Comprehensive Care Program. So basically, that is our clinical program. So we have CCP 3 and CCP 4, or CCP part of third year and part of fourth year. We don't have perio, prosto, resto, endo, and pediatric dentistry all separate. So we have one big clinic. So we get patients assigned, and you are in charge of doing all the treatments for that patient in that clinic. So we don't have separate posting in separate departments. So we don't go to the endo department or resto department or cons department and have a posting for a month. We are posted throughout the year in the CCP clinic, and we basically treat everything for the patient in a CCP clinic. So if I see a patient here, the patient might have the need for a pulpectomy or an endo. He might need a crown. He might need scaling, root planing, periodontal surgery. He might need after that maybe a bridge or a denture, and then maybe referral for implants or then implant restorations. So we do everything for that patient. So this is like clinical practice. In your own clinical practice, in your own clinic, you probably see a patient and you will do everything for the patient. And we get into the habit of doing this only when we go into clinical practice in India.
How is your routine in your dental school? Like we have one lecture, one posting in India. How is your curriculum? Like how does your day starts in your dental school?
So right now my days have kind of winded up. I am transferring my cases. I am doing loads of paperwork. So the basic difference in the clinical work here is that you have to do loads of paperwork. You have to do loads of documentation. Um, that is the key. Documentation will make or break your practice, and that is what we're taught from the first day on. So on a routine, when I was in my third year, my day would be something like this. At 8 o'clock, I would have a lecture in the morning between 8 to 9. From 9 p.m. to 1 p.m., we would have comprehensive clinical care. There would be in the clinic, we would have 1 to 2 patients in that 2 hour or 3 hour appointment. Then we'd have a break between 1 to 2, and 2 to 4 again we'd have comprehensive clinical care, and 4 to 5 we would have another lecture. Now after everything went online, this was again pre-COVID, but post-COVID, when everything went online, we started having asynchronous and synchronous lectures. So synchronous lectures were where you would have to be in the lecture to attend it. It was a live lecture. Asynchronous lectures were previously recorded podcasts and videos. So asynchronous lectures, you could basically sit and see about 5 lectures or 6 lectures on a Saturday, on Sunday, and you can just complete that. And synchronous lectures would be in the evenings after your clinical practice. So in the fourth year, we would have 3 sessions or 4 sessions throughout the day of clinical practice. And then you would have a synchronous lecture at about 5 o'clock to 6 o'clock in the evening. So it is a packed day, but you get used to it. So you see about 4 patients a day, and then you have maybe an hour of lectures as such. So it's more focus on clinical care and less focus on just academics as we go from first year to final year. So in the first year, second years, you have days packed with lectures. You would have 4 or 5 lectures in the day, and you'd have some days completely free. So you'd be at home on, say, a Tuesday or a Wednesday in the middle of the week, absolutely nothing to do. So that's how dental school is. Even though say it's full time, it's not full time like we consider 9 to 5 in India. It is full time in terms of the course load or the credit load that students have to take up. Yeah, it is very, very flexible as you go from first year to final year. And basically, clinical part, it increases as you come towards the fourth year.
So you are completing this in 2 years.
We complete it in 2.5 years. So this differs from university to university. Some universities have a 3-year program, some have a 2-year program, and University of Toronto has a 2.5 year program. So at University of Toronto, we call it the IDAP program. So when we We join in January, and from January to July, there's a 6 month program that we have to go through that basically tests all our clinical skills and all our preclinical skills. We have lectures on basic materials like dental materials, biochemistry, physiology, all what we do in the first and second year. And at the end of the 6 months, we are judged to be on par with the second year graduating students. So we go from that 6 month program into the third year. We join the third year DDS program. Then we do the third year DDS. Then we do the fourth year DDS. So at the University of Toronto, it's a 2.5 year program. 2 years for TDS, year 3 and year 4, and 6 months for the IDAP program, or the Internationally Trained Dentist Advanced Placement Program. It's a mouthful.
Yeah. So let me ask you the last question for this podcast, and maybe we can continue with another one podcast where I will ask you more about the exams. Can you do a post-graduation after your DDS?
Absolutely. So you can actually specialize in any field that you want after your DDS. And it depends on how well you perform at dental school. Because when you apply for postgrad courses, when you apply for master's or a PhD, they look at your GPA for the 2 years of dental school, that is third year and fourth year. They look at whether you're a good candidate, whether you've had some clinical experience as well. So right after dental school, you can start applying for residencies like a hospital rotations or hospital residencies for 1 year. You can apply for the advanced general dentistry or AGD programs in some schools in the US and Canada. You can apply for master's programs directly at the various universities. So University of Toronto is the only dental school in Canada which has all of the dental specialties in the one single institution, all under one roof. So the latest dental specialty, dental anesthesiology, we are the only ones in the country that have a course for dental anesthesiology. So you can apply to any program that you want. Right now, I know some of my classmates, they are already, so they haven't really completed the DDS. They're still with me in fourth year, but they've already applied and they've gotten selected into master's programs at UBC for orthodontics. I know 3 people have gotten selected in orthodontics at UBC. I know 2 people who've gotten selected right here in the University of Toronto for periodontics and dental anesthesiology. So, yep, you can apply for master's programs directly after your DDS.
Well, my dear friends, in this podcast, you got so much in-depth information regarding the initial information about your PR, about the dental schools. And thank you, Dr. Sagar, for your precious time.
It was my pleasure. It was my pleasure being here. And yeah, this was an amazing experience. Thank you. Thank you for inviting me.
In the next part of this podcast, we'll be discussing about the exams, especially the licensure exams. I thank you, all of you, for watching this podcast. Make sure you subscribe to the channel, click the like button, and share this video with your friends if you found this video helpful. Bye for now.